everyone. You're welcome back to my channel, The Nice Nurse Cares, with your popular nurse, the nurse in pink, Nurse Esther. Today, we'll be discussing how to calculate pregnancy due dates. So, let's get started. Your pregnancy due date can also be called your EDD or your expected date of delivery. Pregnancy lasts an average of 280 days or 40 weeks from the first day of your last menstrual period. The first day is called day 1 of pregnancy, even though you probably did not conceive about 2 weeks later. The first day of your LMP or last menstrual period is explained thus. If your period starts from June 1st and ends around June 5, June 1st is your first day of your last menstrual period. It is important to have an idea of when your baby will be born, but try not to get attached to a particular date because mothers, let me tell you, some babies can surprise you. If you have a 28-day menstrual cycle, the Naegeles method is best for you. This is a simple way of calculating your expected date of delivery or EDD. To calculate your EDD with the Naegeles method, add 7 days to the first day of your last menstrual period. Let's say, for example, that your last menstrual period was in June 2021. The first day of your menses was June 1st. You add 7 days to June 1st, making June 8th, 2021. Next, subtract 3 months from June. You have March 8th, 2021. If necessary, change the year. In this case, you change the year. So you get March 8th, 2022. That is a simple method for calculating your EDD for a 28-day menstrual cycle. Another method is using the pregnancy wheel. First step is to locate the last date of your LMP on the wheel. When you line up that date with the indicator, the pregnancy wheel displays your expected date of delivery. Remember that your due date is only an estimate of when you will deliver your baby. Mothers, how many of you have delivered on the exact date that you were given? Let me know in the comment section. Some might ask, what if I don't know my LMP? There are ways to figure out your due date when you can't remember the first day of your last menstrual period. If you know you had your LMP during a particular week, your healthcare provider can estimate your due date accurately. If you had no idea at all when your LMP was, your doctor may order an ultrasound to determine your due date. Some mothers have irregular or longer cycles. Your healthcare provider can use the pregnancy wheel with some simple calculations. The second half of a woman's menstrual cycle lasts for 14 days. 35 days is an average estimation for a long period. If you remove 14 from 35, you have 21 days. So that means you probably ovulated on the 21st day of your 35-day period. For example, first day of your LMP was November 22. If you subtract 14 days from November 22, you will have November 8. Your adjusted LMP will be November 8 if you subtract 14 days from November 22. Simply mark November 8 on the pregnancy wheel and it will display your pregnancy due date. Now that brings us to another question. How accurate is an ultrasound in determining the gestational age of your baby? Generally, your doctor will order an ultrasound to determine the gestational age of your baby if the date of your LMP is uncertain, if you have irregular periods, or when conception occurs despite the use of contraceptives. An ultrasound allows your doctor to measure the length of your baby from one end to another, and that is called the crown rump length. During the first trimester, that is the first 3 months, that measurement provides the most accurate estimation of your baby's age. In the second trimester, an ultrasound is less accurate, and in the third trimester, it is least accurate. Ultrasound measurement for estimating the gestational age of your baby is more accurate during early pregnancy. In the first few weeks, fetuses tend to develop at the same rate. However, as pregnancy progresses, the rate of fetal growth begins to vary from pregnancy to pregnancy. This is why ultrasound measurements cannot be used to accurately predict the age of a baby in the later stages of pregnancy. According to a trusted source, ultrasound are not a necessary part of prenatal care. Avoid numerous scans and have ultrasound for medical reasons only. Do not forget to subscribe, comment, and share. And give me a thumbs up, please, so that this video can get to others. Thank you.